us an idea of how exponentials are going to address some of the biggest challenges we have in healthcare. We have, cost, access, fragmented care, care variation, even within our communities in the U.S., but care variation around the world. How does exponentials start to change that paradigm?
I think in a sense, there's lots of challenges, and healthcare is kind of like politics. It's a bit local. So, so many different healthcare systems, as you know, might have different challenges and needs, some which are overlapping. I think where it provides the biggest opportunity is to move from, again, somewhat buzzwordy. We want personalized and precision medicine, but in reality today, we're still practicing kind of one size fits all medicine, often the same dose of statin we start with. If you're managing a patient with hypertension or diabetes, we're starting with the same drugs, trial and error, broken feedback loops, still communicated by fax machine in many cases. And so the opportunity is now to take the increasingly exponentially more available, accessible data, whether it's our digital exhaust that can be picked up by our wearables or our smartphones or our connected mattresses, and start to connect that into our healthcare system. And as you've discussed in prior shows, kind of meld that information so we understand what it means. What does it mean if my Fitbit or my mattress sensor tells me that my resting heart rate's normally 55, but it's last couple of months it's creeped up to 75. Something might be happening. How do we take that baseline of data like Verily is doing with the baseline trial, or now the All of Us trial at NIH, and start to understand what do some of these new biomarkers, digital omics, social metrics start to mean, and be then much more proactive and start to shift our sick care system to more of a healthcare one, where we can utilize this sometimes overwhelming amount of data and turn it into proactive, useful information that fits into the workflow of the poor of a work clinician. There's some great solutions already here today, but they're not being utilized for reimbursement issues or someone moving someone's cheese, turf battles. There's a lot of other elements beyond the technology itself, the incentives, the user interfaces that need to be put together as well.